Hello, good evening everyone. Just wait for the confirmation before beginning the session. Number of days have passed since the exam and result has also been declared. Okay, so we're waiting for the confirmation before starting it. The aim of these sessions are just to recollect these questions and then you know get prepared for upcoming exam. Okay, so once again, good evening everyone. Myself, Dr. Rijul Agrwal. I'm the orthodontic faculty at DAMS. So today we are here to discuss the orthodontic question based on the recall. Students, please note these are the recall based questions, so they might recall plus questions collected from a number of groups. So there might be a discrepancy. I've tried to incorporate as much as possible and to minimize that. If there is any discrepancy, do let us know in the comment box and we'll be happy to correct it. Okay. If not in the comment, you can always send us and we'll correct, and if any pending questions remain, we will discuss in the subsequent classes as well. So once again, good evening everyone. I can see a number of participants have already joined. So as I was telling, the aim of these sessions are not to scrutinize the exam or what has happened, because the truth be told, it's not in our hand. The questions are being made by the concerned faculty. We are here to just analyze and recollect and get us where we lag behind. Okay, and to get to know if there is some topic or some part which we don't know, so that we can correct them, and in the subsequent exam that mistake is not repeated. Okay, so we'll start. Okay, I expect any discrepancy, if present, you do let us know. We'll correct it in our session right here and only. Okay, so the first question which we got from the students: so bilateral cleft lip occurs due to the failure of fusion of. So the options which I got was option A, lateral nasal process and medial nasal process; lateral nasal and frontonasal process; frontonasal process and medial nasal process; maxillary and mandibular process. So according to me, if these options are all correct, technically all of these options are not correct. Okay, so but taking it into consideration, that let us assume these four only came. Why all these not correct? Because cleft lip, as I've already told you, occurs due to the failure of fusion of the maxillary and the medial nasal process. Why? Because as we all know from our embryology classes, this is the classical diagram from the embryology. So this is the medial and this is the lateral. The maxillary process fuses with the medial nasal process to form the upper lip. Defective failure of fusion leads to cleft. But since there was no option like this, so the best option out of these would be the frontonasal and the medial nasal. I'll again tell you why I chose this option. Because the frontonasal, this green part, frontonasal process comes from the, and this is the medial nasal. This is responsible for the formation of the philtrum of the lip. Okay, so out of all these options, if we consider them, D is defective maxillary and mandible process. As we all know, there is no such fusion, so it's ruled out. Lateral nasal and medial nasal process. Lateral and medial nasal process leads to the formation of the nasal placodes or the nostrils. Lateral and the frontonasal process do not fuse. So the best option out of, after ruling out the three, is comes out to be C only. So the frontonasal and the medial nasal process. I hope it's clear. Okay. Now this is a easy question. Up to what age thumb sucking is considered to be physiologically normal? As you all know, it's normal up to 3 to 4 years of age. Till 3 to 4 years, no orthodontic or intervention is carried out. It's considered absolutely normal. So out of the options, 4 years was there. Okay, so 4 years is the correct. अगर supposedly यहाँ 3 years भी option होता, let us assume second option 3 होता, तब क्या टिक करते? Okay, then also we would have ticked, because सारी books में 3 to 4 years की ही range है, कहीं पर specific ये नहीं mention है कि 4 or 3 is the, every book, every literature says it's normal, physiologically normal up to 3 to 4 years. अगर 3 और 4 दोनों option में, like it happened in the previous NEET exams, because there were a lot of questions, that's why I'm discussing this, that there were a lot of questions with close or similar options, so it was difficult to pinpoint the correct in the NEET. So taking into consideration, so if the 3 or 4 years दोनों option होते, then also 4 is more correct than 3. Okay, so 4 years, up to 4 years, thumb sucking is considered physiologically normal and no such intervention is carried out. Okay, every intervention like reminder therapy or any such intervention is carried out after it, 4 years on. Psychological intervention or okay. Next question. At what age Mesiodens should be extracted? Now this was a little tricky or confusing question for some of the students. I'll try to simplify it. So students, what happens? Why first of all, why should Mesiodens should be extracted? Let us forget about the age. Mesiodens, if present, will lead to the midline diastema or spacing between upper and medial teeth. अगर ये, as we all know, this is a simple thing, midline diastema or spacing between upper and anterior teeth. So from orthodontic point of view, if it's present, should be removed for closure of the gap. Now what are the options? Immediately as it is discovered on radiographs, only after 12 years of age during initiation of fixed orthodontic therapy. Third, after complete root formation of permanent incisors. Fourth, after half to 2/3 root completion of incisors. So the correct answer is option A, that is immediately as it is discovered on the radiograph. Why? The answer lies in this reason only. Why? Because it leads to development of spacing between anterior teeth. अगर जैसे ही हमने उसको देखा, if we remove it, there is a possibility that with the eruption of permanent teeth, with the eruption of canines, supposedly we found it earlier, a gap automatically closes. The longer we delay this extraction, the more permanent this gap becomes and will lead to orthodontic intervention. So that's why the Mesiodens should be immediately extracted. Okay, this is a contradictory or direct opposite question of the one which we have discussed in class, in which we have discussed presence of midline diastema, okay, at the age of 7 or 8 years. So what will we do? Orthodontic intervention? No, we'll wait for the eruption of the permanent canines, because it's normal until the canines erupt because of the presence of ugly duckling stage. So उन्होंने थोड़ा सा क्वेश्चन को ट्विस्ट किया and they asked out Mesiodens, but the answer here is that it should be extracted immediately because it will lead to the development of diastema or space between the upper anteriors. So as to avoid that, it should be immediately extracted. Okay, next question. Sorry. Next question. Now this is a direct or easy question. In CMI stage, sir, accelerated or peak mandibular growth corresponds to which of these stages? CMI stands for cervical vertebra maturity index. This time, according to the recall questions, I have encountered such questions have come based on skeletal maturity indicators. One is here. Next, we'll be discussing in the subsequent slides. So in CMI, accelerated or peak mandibular growth corresponds, so as we all know, it's a direct question, nothing to discuss, that is corresponds to cervical vertebra maturity 3 and 4. Okay, why it's important? Because the patient has hit puberty and it's important for the starting of functional appliance therapy. Okay, functional appliance therapy. That's why CVMI stage 3 and 4 is the beginning. So what is CMI stage 3? That is CS3. How will you identify on the lateral cephalogram? The lower borders of C2 and C3 will be concave. Okay. Bodies of C3, C4 will be trapezoid or rectangular horizontal in shape with peak in mandibular growth will occur within 1 year of this stage. And 4, the lower borders become both C2, all three of them, C2, C3 and C4 become concave, and the peak in mandibular growth has occurred within 1 or 2 years before this stage. So put 3 is the best one, and 4, okay, well, you can initiate functional appliance therapy for correcting class 2 malocclusion. Okay. Okay. Now this again a very simple direct question. Even if you don't know what is lingual arch, you can answer this. So how? So what is the indication of lingual arch appliance? They have got 5 options in it. So I have multiple students have given me 1 or 2 options different. So I mentioned all 5. Okay. So what is the indication of lingual arch appliance? Okay. Multiple mandibular molars decayed and need to be extracted. Multiple maxillary molars decayed and need to be extracted. Proclined maxillary incisors to prevent tongue thrusting habit, or all of the above. Students, if we even don't know कि lingual arch appliance होता क्या है, still we can answer this question how. Lingual arch means something related to the one given in the lower jaw or the mandible. ये तो डायरेक्ट अंडरस्टैंडिंग से ही पता चल रहा है. तो ऐसा कोई भी ऑप्शन इसमें जो है दैट नीड्स टू बी एलिमिनेटेड, लाइक जो मैक्सिला को हाईलाइट करता है, लाइक ऑप्शन सी, ऑप्शन बी. ओके, बी और सी गया तो ई इज ऑटोमेटिकली एलिमिनेटेड. सो बचे क्या? ऑप्शन ए और डी. टंग थ्रस्टिंग हैबिट के ऑप्शन जो भी अप्लायंस देता है, एज वी ऑल नो, इज गिवन इन द अपर आर्च. सो ऑप्शन डी इज ऑल्सो एलिमिनेटेड डायरेक्टली. Option A is the correct, left one, which is the correct answer. So lingual arch appliance, to further discuss, it's a space maintainer, or in permanent teeth it can also act as an anchorage device. Okay, to prevent the mesial migration of the posterior teeth so as to prevent the loss of space. So in cases where multiple mandible molars are decayed and need to be extracted, lingual arch appliance is given so as to prevent the mesial migration and loss of space. Okay, that was a very quite easy question. Next question. Which of the following appliance is not used in the treatment of buccal crossbite in maxilla? Again a very direct and easy question. Okay, buccal crossbite in maxilla means they are asking about expansion appliance, and the question is saying not used. तो इनमें से जो भी expansion appliance का example नहीं होगा will be your answer. So Hyrax appliance, yes, it's expansion, it's a rapid maxillary expander appliance. Quadhelix, again a slow maxillary expander appliance. Jones chick, no, this is not the expansion, this is a distalizing appliance. Last is pendulum with Hyrax. Again, pendulum is a distalizing appliance, but the option says with Hyrax. So it becomes a expansion appliance. So the correct answer will be here will be Jones check. Just simple question. अगर आपको examples भी याद है rule out करके very easily, I think most of the students, the feedback which I got, were able to answer this question. So nothing much to discuss. Okay. Coming to the next question, what is the typical facial appearance of patient who engages in thumb sucking? Okay. Another similar question from habits, and that too from thumb sucking. Okay. Lot of pattern based questions, like दो question आए हैं skeletal maturity से, दो question direct habit से है. Okay. So again a easy question. So as we all know, thumb sucking है, patient is putting his thumb inside the mouth. So what happens? The mandible drops down. What are the external features if you all remember from our classes? Mandible drops down, तो उससे क्या होगा? Vertical increase होगा. External features of thumb sucking. Vertical increase होगा तो क्या होगा? Profile क्या होगी? Convex हो जाएगी. Okay. And facial height क्या होगी? Will increase facial height. Plus और क्या होगा? Incompetent lips. Okay. So these are the typical external features of a patient with thumb sucking habit. And also these similar kind of features are seen in another habit, that is the mouth breathing. But उसमें एक और feature add हो जाता है, जैसे that is adenoid faces, if you remember. I always tell कि students link करके अगर आप पढ़ेंगे तो याद करना easy हो जाएगा. Okay, so the answer will be long and convex. Okay, easy question. Now this was the question which I was telling. Another question, a skeletal maturity indicator is not measured by which of the following? Again a question with not measured. In the current scenario जहाँ 50-50 questions के बाद they are changing the set, ये not measured और ये जो questions have increased. Why? Because students जो जल्दबाजी में they tend to skip, और कि भाई जल्दी पढ़ो आगे बढ़ो, the stat यहीं पर you tend to start having negative markings. Okay. इससे पहला क्वेश्चन भी दिस ऑल्सो, दिस आर वेरी सिंपल क्वेश्चन. इवन इफ यू डोंट नो कि क्या है, बिल्कुल मतलब पढ़ा ही नहीं है, देन ऑल्सो यू कैन आंसर दिस क्वेश्चन. Skeletal maturity index is not measured which of the following? Common sense भी if you all know, hand wrist radiographs, cervical vertebra are used to measure. At region of tooth से no one can measure skeletal maturity indicator. There is nothing much to explain. The correct answer here would be at region of tooth. Okay. Dental calcification, as we all know from our DADH classes, is a method for measuring dental maturity, not skeletal, dental maturity indicator. And what is the method known as? That is the Demijan method, in which we measure the calcification of lower left mandibular teeth. So again a simple and a basic question. Okay, skill to answer. Just थोड़ा सा ट्विस्ट करते हैं, नॉट ऐड करते ही ऑल एक्सेप्ट नॉट. these are the common synonyms which are there in the exam. and जो वो 50 questions के बाद सेट चेंज होना है, उसी हड़बड़ाहट या whatever से जल्दी में students tend to miss it and have a negative. Okay, that's why I have told you in the beginning, these sessions are for us to highlight these things only, कि ये mistakes आगे ना हो. In the new INI in the new NEET pattern as well, they have incorporated this time method in which there will be 4 sets and the set will change. तो वहाँ भी same गलती नहीं होगी. Okay, so coming to the next question, again direct and a very easy question. Mesial step in decidual dentition represent. So this is based on Baum classification of primary dentition. Okay, the correct answer will be mesial step is distal terminal of maxillary second molar is distal to the distal terminal of mandibular second molar. So if you all remember, इस बार इन्होंने डायरेक्ट क्वेश्चन पूछा है. They haven't asked कि it will convert into like in the previous NEET exam only. They asked कि what this will convert into. So this part they haven't asked this time. They have asked you this direct question in INICET. Concept वही है, या तो next time हो सकता है इस पे पूछ लेंगे या they will shift हो. They are just you know same concept, twisting the question and asking. So mesial step is this one, in which the distal part of the maxillary primary second molar is distal to the distal terminal of the mandibular primary second molar. Flush terminal, in which they are coinciding. Distal step, it will be, the word will be mesial to the distal terminal of the primary mandibular second molar. Nothing much to explain, just a direct theoretical question. Okay, inclined plane appliance is used for correction of, ये यहाँ पर थोड़ा सा students got confused because they just wrote inclined plane. Students please note, inclined plane हमेशा first of all जो दिया जाएगा anterior में ही दिया जाएगा. Inclined plane cannot never be given in the posterior teeth. Okay, या तो inclined plane upper में दे देंगे और lower में दे देंगे. अगर upper inclined plane है और या लोअर इंक्लाइन प्लेन है, या दूसरी चीज़ जो आती है अगर इंक्लाइन प्लेन ना हो, या तो आता है बाइट प्लेन. ब्लाइट प्लेन कैन बी गिवन इन एंटीरियर प्लस पोस्टीरियर. अगर एंटीरियर बाइट प्लेन दिया जा रहा है तो इट इज़ यूज्ड फॉर द करेक्शन ऑफ डीप बाइट. अगर पोस्टीरियर बाइट प्लेन दिया जा रहा है इट इज़ यूज्ड फॉर द करेक्शन ऑफ एंटीरियर क्रॉस बाइट. अगर इंक्लाइन प्लेन दे रहे हैं, अपर इंक्लाइन प्लेन दे रहे हैं, इट इज़ यूज्ड फॉर ब्रिंगिंग द लोअर टीथ फॉरवर्ड. और अगर लोअर इंक्लाइन प्लेन दे रहे हैं इट इज़ यूज्ड टू द करेक्शन ऑफ एंटीरियर टूथ क्रॉस बाइट. ओके, अब इन्होंने इंक्लाइन प्लेन लिखा है बट ये कहीं नहीं लिखा कि इट इज़ वेदर इट इज़ अपर और लोअर, और माइट बी पॉसिबल कि रिकॉल में प्रॉब्लम हो. लेट अस अज्यूम क्वेश्चन ऐसा ही है दैट दे हैव नॉट मेंशन, दे हैव जस्ट आस्क्ड इंक्लाइन प्लेन इज यूज्ड फॉर द करेक्शन ऑफ, एंड वी डोंट नो वेदर इट्स एन अपर और लोअर इंक्लाइन. सो बेस्ड ऑन द थ्योरी विच आई हैव जस्ट टोल्ड यू, अगर अपर होगा इट इज़ यूज्ड फॉर ब्रिंगिंग द लोअर टीथ फॉरवर्ड और फॉर क्लास 2 करेक्शन. डीप बाइट, as I've already told you, it's for given by anterior bite plane, so ये option eliminate हो गया. posterior cross bite, posterior cross bite के लिए भी again anterior bite plane ही देना पड़ेगा, जिससे क्या होगा, why anterior bite plane, it will lead to posterior teeth disocclusion and then only you can correct the posterior cross bite. So this option also gets eliminated. ओके, ओपन बाइट, ओपन बाइट के लिए क्या करना होगा, एंटीरियर ओपन बाइट है तो हम व्हाट डू वी नीड इज पोस्टीरियर टीथ इंट्रूजन. पोस्टीरियर टीथ इंट्रूजन चाहिए. पोस्टीरियर टीथ इंट्रूजन कैसे होगा, बाय पोस्टीरियर बाइट प्लेन. पोस्टीरियर बाइट प्लेन पे जब पेशेंट रिपीटेडली बाइट करेगा इट विल लीड टू पोस्टीरियर टीथ इंट्रूजन एंड करेक्शन ऑफ एंटीरियर ओपन बाइट. सो दिस ऑप्शन ऑल्सो गेट्स एलिमिनेटेड. द ऑप्शन विच आंसर विच रिमेन्स इज एंटीरियर क्रॉस बाइट. सो वी अज्यूम दैट इट दे हैव द एग्जामिनर वांटेड टू राइट और गिव इट अ लोअर एंटीरियर इंक्लाइंड प्लेन इज गिवन फॉर द करेक्शन. सो व्हाट इज दिस लोअर इंक्लाइंड प्लेन इज ऑल्सो नोन एज Quadhelix appliance. It is cemented on the mandibular incisors for correction of upper anterior single tooth crossbite that is of, please remember that it is of recent origin, not a well established one. अगर well established हो जाएगी तो क्या होगा, अगर recent नहीं हुआ तो क्या होगा, then how will be corrected, then उसके लिए हमें या तो Z spring appliance या फिक्स्ड ऑर्थो और फिक्स्ड ऑर्थो चाहिए होगा फॉर इट्स करेक्शन। प्लस अगर सिंगल टूथ भी ना हो, दो चीज़ें हैं, दैट्स व्हाई आई बोल्ड सिंगल टूथ एंड डिसेंट ओरिजिन, बोथ केसेस में फिक्स्ड ऑर्थो या जेड स्प्रिंग अप्लायंस विल come into play. Next, how it's constructed? It's constructed at an angle of 45 degree to the maxillary occlusion plane. And second, it should be not to be used for greater than 3 weeks. Why? जब lower anterior inclined plane लेंगे तो what it will happen? Posterior teeth disocclude हो जाएंगे. Posterior teeth will get disocclude. जैसे ही वो disocclude होंगे, as we all know, the teeth start erupting. There is a eruption component because of disocclusion. So उससे क्या होगा? Extrusion of these teeth. Okay. Next question. Again, a question on multiple answer correct options question. Which of the following statements is true about Quadhelix appliance? Quadhelix, as we all know, is a slow maxillary expander given by Ricketts. Okay, so it uses wire made of 0.038 inch alveolar wire. It uses wire made of 0.038 inch SS. The force applied is 100 to 200 grams. The force applied is 200 to 600 grams. Questions like these are direct theoretical based questions. Okay, so the correct answer is made of 0.038 inch SS. And the force applied is 200 to 600. So the correct answer will be option B and D. Okay, nothing to explain here. So this is a Quadhelix appliance. This is how it looks. This first is the coffin spring, which was later modified into this Quadhelix appliance. Okay, what was the advantage of Quadhelix appliance? Coffin spring was able to only bring expansion in the posterior region, whereas Quadhelix, with the help of Quadhelix, we can expand anterior or posterior based on our requirement. जहाँ का bridge be open, that region gets expanded. Okay, its explanation and all we have discussed in our class. Okay, here we are just here to discuss the questions. So this is the correct answer and just this is the Quadhelix appliance. अगर anterior bridge open करेंगे, it will the posterior helices get posterior arms get open up. Okay, and subsequently vice versa. Next question. Which of the following does not compensate for incisal liability? So what is incisal liability? The difference in the size of primary and permanent incisors. The mesodistal width का जो difference है permanent and primary incisors का constitute a liability. एंड अगर वो इंसाइजर रीजन में है, दैट इज़ नोन एज इंसाइजल लाइबिलिटी. तो वो जो डिफरेंस साइज का है, हाउ इज़ इट कंपनसेटेड? हाउ इज़ इट कंपनसेटेड इन द एंटीरियर रीजन? अगेन अगर हम ऑप्शंस पे जाए, वी डोंट नो, इंसाइजल वर्ड से ही देख लें. ठीक है, लेबल इरप्शन ऑफ इंसाइजर्स, ओके, ये एंटीरियर रीजन में, तो ये कुछ शायद सही होगा. इंटरडेंटल स्पेसिंग, ओके, एंटीरियर पोस्टीरियर दोनों में हो सकता है. इंक्रीज इंटरडेंटल स्पेस, ओके, एंटीरियर. तो बचा कौन सा ऑप्शन? Does not compensate, again a not one. That is increase intermolar. Intermolar space increase होगी तो incisor region में spacing नहीं देगा. Common sense. So again a question, अगर आपको कुछ भी नहीं पता है, just by reading and थोड़ा सा दिमाग लगा के, they are not, does not an incisor liability. So the correct answer is B. So what is incisor liability? I have already told you. अगर हम mm या dimension wise जाए, in the maxillary arch it is 7.6 mm, and mandibular arch it is 6 mm. Okay, so what is the aim? So how this 7.6 and 6 mm spacing is compensated? So 3 mm maxilla and 2 mm by interdental spacing. Okay, in the anterior teeth. Absence of this spacing, as we have already told you, is known as Hollywood smile. Absence of spacing in primary dentition. Next is labial eruption of incisors. The incisors erupt, the permanent incisors erupt labial to the primary incisors. So उससे 2 mm space मिलती है maxilla में and 1 mm in the mandible. Okay, and lastly the increase in the intercanine arch width contributes to the rest of the incisal liability or the spacing which is required. Okay, early mesial shift, late mesial shift is responsible to compensate for the spacing in the posterior region. Incisal liability in 3 चीज़ों से it gets compensated. So this is the correct, that is does not count. Next question, pre-surgical nasoalveolar molding is done to. So what is pre-surgical nasoalveolar molding? A question from the cleft, orthodontics. In our last YouTube sessions as well, I have told you that nowadays examiners are repeatedly focusing on these offbeat topics which I call orthosurgical, obstructive sleep apnea and cleft orthodontics. Why? Because students tend to generally miss out. ज़्यादा focus appliances, okay, functional appliances उस पे ज़्यादा रहता है ऑर्थो पे. ये टॉपिक्स को थोड़ा सा इग्नोर मारा जाता है एंड recent एग्ज़ाम में ट्रेंड चेंज हो गया है. दे every exam has 1 or 2 questions from cleft. That's why in the previous YouTube sessions where I have already started from, okay, we have started from cleft only, cleft, orthosurgical, just to highlight their importance, and in our subsequent sessions as well we'll be discussing them in more depth. So what is pre-surgical nasoalveolar molding? So this is a PNAM or a pre-surgical nasoalveolar molding appliance. So why it's done? It's done with the objective of positioning the cleft segments into an ideal relationship before a definite surgery is carried out. So what is it? This is a appliance. Okay, ये इसका intraoral part है and ये this is the nasal stent which goes into the baby's nose. Why? So just have to give support to the columella. Okay, so consists of an intraoral molding plate, nasal stent and a extraoral taping. Extraoral taping क्यों की जाती है? To bring or approximate the lip segments. अगर हम उनको approximate नहीं करेंगे and the surgeon carries out the surgery, there will be so much tension in the sutures that there is a possible that the surgery might fail. That's why before the surgery this extraoral taping is done. This intraoral molding plate is done with a similar objective to bring the alveolar segments together. And nasal stent, as we all know, नाम में ये nasal stent goes into the nose to elevate the nasal tip. So the alveolar ridges are molded to reduce the size of the cleft to approximately 1 to 2 mm of each other. So how it is molded? Each weekly appointment में इसको यहाँ से trim करते जाते हैं. So trimming से क्या होगा? वो active force देता जाएगा appliance में and approximate the segments. Please note, the aim is only to approximate the segment. Definite repair surgery के through ही होता है. So the use of nasal stents and taping lengthens the columella and realigns the lower lateral alar cartilage with the goal of preparing the infant for one stage primary lip and nose repair. Okay, and as we all know, इसका PNAM का advantage क्या है? क्यों किया जाता है infant? Because of the presence of hyaluronic acid levels are high in infants, जिसकी वजह से जो tissues are moldable and can be molded or formed into a desired shape. Coming back to the question, passively keep the nasal fragments and lip segments in contact? No. प्री-सर्जिकल मैनर डेफिशिएंसी फॉर एनहांस फंक्शन, नो। वाई? ये काम कौन करता है? ये काम करता है ऑब्चुरेटर। जो डेफिशिएंसीज है, पैलेट में होल है, जो फीडिंग नहीं हो पा रही है, स्पीच डेवलप नहीं हो रही है, तो उसका काम ऑब्चुरेटर करता है, पीनैम अप्लायंस नहीं करता। दिस इज ऑल्सो नो। ब्रिंग लिप सेगमेंट्स इनटू कॉन्टैक्ट, पार्शली करेक्ट बट नॉट टोटली करेक्ट। वाई? बिकॉज ये लिप टेपिंग से होता है, एंड लिप टेपिंग इज अ सेपरेट और अ पार्ट ऑफ पीनैम, ठीक है। पीनैम इज डन टू लेंथन द columella passage. Columella, as we all know, is the nasal nose tip, and here the appliance photo inside the patient mouth is shown. See how this depressed nose and now is elevated, and the lip segments are brought in contact with this appliance. Okay, so I hope it was clear. Coming to the next question, what is the appliance shown in the image? Again, I have got two types of images. Some said this one came, some said this was came. जो भी आया है इमेज, आंसर बिल्कुल बदल जाएगा. अगेन ऑप्शंस वर ऑल्सो 5. ओके, अगर फर्स्ट इमेज आया है, फर्स्ट इमेज इज ऑफ अ हाइब्रिड टी-रेक्स अप्लायंस, और नेक्स्ट ये है फ्रॉग अप्लायंस. अब ये इमेज देखते ही पीपल वर लाइक कि वी हैवंट सीन इन द क्लास, ये कौन सा इमेज है, क्या है, वी डोंट नो. So I'll try to simplify it. What was these images? Students please note, कभी भी अगर ये हाइब्रिड वर्ड लगा रहे हैं कोई भी अप्लायंस के आगे, हायरेक्स हमने सब देखा है, पेंडुलम सबने देखा है, टी-रेक्स की फोटो सबने देखी है, फर्स्ट क्लास अप्लायंस भी सबने देखा है, फ्रॉग अप्लायंस आई हैवंट शोन. दिस वाज अ न्यू थिंग. सो जब भी ये हाइब्रिड वर्ड लगा रहे हैं, हाइब्रिड का मतलब है उसमें कुछ मॉडिफिकेशन की है. क्या मॉडिफिकेशन की है, ये डिपेंड्स ऑन वेरियस ऑथर टू ऑथर. कोई ना कोई, अगर सम ऑफ यू टेक पोस्ट ग्रेजुएशन इन ऑर्थोडोंटिक्स, विल ट्राई टू कम अप विद द मॉडिफिकेशन ऑफ दीज अप्लायंसेस, एंड यू कैन गिव देयर ओन नेम और यू कैन जस्ट राइट सिंपली हाइब्रिड. जनरली हाइब्रिड मतलब क्या होता है, दे ऐड टैड्स फॉर एंकरेज, फॉर बेटर एंकरेज सपोर्ट. ओके, तो अगर पेंडुलम में विद इम्प्लांट दिख जाए पैलेट में, दैट विल बिकम्स हाइब्रिड पेंडुलम. टी-रेक्स अप्लायंस अगेन जैसे ये है, सो इसमें इन्होंने पैलेटल स्क्रूज दिख रहे हैं, अगेन बिकम्स अ हाइब्रिड अप्लायंस. हाइब्रिड हायरेक्स क्या होगा, हायरेक्स स्क्रू विद द इम्प्लांट इन द पैलेट, सो देन बिकम्स अ हाइब्रिड हायरेक्स अप्लायंस. फर्स्ट क्लास अप्लायंस एज वी ऑल नो इज अ डिस्टिलाइजिंग अप्लायंस. तो ये ऑप्शन तो पहले ही एलिमिनेट हो गया. पेंडुलम हमने सबने देखा है, ये भी ऑप्शन एलिमिनेट हो गया. ये भी गया, ये भी गया. हायरेक्स वी हैव आल्सो सीन, ठीक है. तो हायरेक्स में एज वी ऑल नो यहाँ से ऐसे विंग्स निकलते हैं, सो ये भी हायरेक्स नहीं हो सकता, ये भी एलिमिनेट हो गया. ठीक है, बी और सी है हमारे पास, ऑप्शन 2 बचे. सो अगर फर्स्ट इमेज आया है, फर्स्ट इमेज एज ऑलरेडी टोल्ड यू इज़ अ हाइब्रिड टी-रेक्स अप्लायंस. टी-रेक्स हमने अप्लायंस सबने देखा है, जस्ट दे हैव एडेड दीज पैलेटल 2 screws to increase the anchorage of the appliance. So how it becomes a hybrid T-rex appliance. What advantage क्या है ये T-rex का, it brings about distalizing plus expansion as well. Frog appliance, जब frog appliance is a simple distalizing appliance with a palatal screw. जस्ट ये स्क्रू को टर्न करना है एंड दिस गेट्स ओपनड अप. जो ये विंग्स है मोलर पे है, टेक्स द मोलर्स बैक विद इट. सो इट्स अ सिंपल डिस्टिलाइजिंग अप्लायंस, दैट इज़ द फ्रॉग अप्लायंस. ये फ्रॉग अप्लायंस इज़ अ ट्रेडमार्क्ड अप्लायंस, मीन्स ये कस्टमाइज नहीं होता, जस्ट यू हैव टू बाय इट फ्रॉम द मार्केट एंड प्लेस. कोई इसको बिल्ड या कुछ नहीं करना होता, फैब्रिकेशन नहीं होता है लैब में. Is a customized appliance okay, which comes in the market. You just have to buy it and place it in the patient mouth. इस screw को turn करता है patient या the orthodontist and brings about the distalization of the molars. Okay. Coming to the next question, a big question: peak height velocity and peak weight may be useful to ascertain the growth of an individual. PHV and peak weight velocity. Which of these is true about the relationship between these two? Okay, so peak velocity in height lags behind peak velocity in weight by about 6 to 12 months, the vice versa, and so on. So basically options में different है, 6 to 12 है या 3 है. ठीक है. Theoretical question. The correct answer here is B. पीक हाइट वेलोसिटी पहले आती है, पीक वेट वेलोसिटी उसके बाद आती है. टेक्निकली इट्स लैग्स बाय 12 to 14 मंथ्स, बट जो नियरेस्ट ऑप्शन यहाँ मिल रहा है वो 6 to 12 मंथ्स का है. दैट विल बी द मोस्ट अप्रोप्रिएट आंसर. सो पीक वेट वेलोसिटी रिप्रेजेंट्स द ग्रेटेस्ट चेंज, rate of change in the body mass. So after peak height velocity there exists a time delay that is approximately of 12 to 14 months, and this is period of time, this is referred as peak weight or PWV. So how it begins? It begins with the reactivation of the hypothalamus pituitary gonadal axis, okay, and release of gonadotropins releasing hormone during sleep. Okay, so just similar, अगर peak height velocity आती है तो we orthodontist के लिए puberty hit हुई, we can start the functional appliance. And the peak weight velocity not important from our point of view, but since they have asked, okay, this is the correct answer. Okay, so this was the last or the questions which I've got. Might be possible इसमें कुछ discrepancy and something, we are keeping a tab. Okay, if we find out we'll do notify it कि there is a question which we missed. If any students knows it, do come up with it, we'll be happy to discuss it. Okay, so these are the question. Overall paper में कुछ tricky, कुछ easy, कुछ direct questions थे, but it was not something एकदम out of the blue जाके कुछ they have asked. Okay, expected cleft question from an expansion or distalizing appliances, growth से question 3 to 4 questions, and a functional appliance question, जो typical trend every exam में है, that is followed. हाँ, repeats कम हुए आए हैं, that I can agree with, and that is all we have to go with. Okay, so anyone has any question or doubt, just can write, or otherwise I am ending the session.